My name is Demetrius Williams and I'm performing tracheostomy care video. I'm in my appropriate school attire, my badge is present. First thing I would do is knock on the patient's door, enter the patient's room and close the door behind me, ensuring patient privacy. I would then apply some hand hygiene. Then introduce myself to the patient and then assist the patient into a Fowler's or semi-Fowler's position for tracheostomy care. I would then suction the tracheostomy tube if necessary. I'm going to open my tracheostomy kit. I'm going to remove my sterile gloves and remove my sterile field. When opening my sterile field, I only want to touch the outside portion of it, making sure not to touch the inside sterile portion. Once I have my sterile field open, I'm then going to dump the remaining contents of my tracheostomy care onto there. Then I'm going to fill the back compartment of my tracheostomy kit with hydrogen peroxide and saline mix, and the front two compartments with just saline. Okay. Once I've done that, I'm going to go ahead and apply some hand hygiene. And go ahead and put on my clean gloves here. Once my clean gloves are on, I want to unlock the inner cannula here and remove the inner cannula, making sure to follow the same curvature. I then want to drop the cannula into the hydrogen peroxide saline mix. Then I want to remove the soiled dressing from the patient. Dispose. Then I'm going to go ahead and remove my clean gloves. Apply some more hand hygiene. Then open my sterile gloves here, making sure to only touch the outside portion and not the inside sterile portion. Applying my gloves using only the cuff portion of the glove. Then using my non-dominant hand, applying the gloves using only the inside cuff portion. Once my sterile gloves are on, I'm going to remove the packaging in the middle, dispose. Once I've done that, I'm going to bring this a little closer to me, and then we're going to clean the inner cannula here. I'm going to grab my brush here, clean the inner cannula, making sure to clean it thoroughly. Dispose my brush. I then want to drop the cannula into the saline mixture here. Once I drop the cannula in the saline mixture, I want to get my cotton swabs here and drop those into the saline mixture. Once I've dropped my cotton applicators into the saline mixture, I then want to replace the inner cannula here. So I'm going to go ahead and replace the inner cannula, making sure to follow the same curvature. Then going to secure it in place here. Once I've secured it in place, I'm going to use my applicators here to clean the site thoroughly. Clean, dispose. Clean, dispose. Clean, dispose. Clean, dispose. Once I've disposed of my cotton applicators, I'm then going to make sure that the site is dry completely. I'm going to dry it thoroughly and completely. Dispose. Once I've dried my site, I'm then going to apply the sterile dressing that needs to go on to the site now. So I'm going to get my sterile tracheostomy dressing here. This is my tracheostomy dressing, and apply it. When applying the sterile dressing, I want to make sure it's secure and in place. Okay. Dressing is secure. Then I'm gonna change the tracheostomy tie that's on here and apply a new tie to it. So we're going to untie it here. When I remove the tie, I want to make sure to hold the tracheostomy tube in place so it's secure. I then want to place my new tie. Into the hole here, across, and then around. And once the tie is around, I'm then going to tie a knot to make sure that the tube is in place. Tie the knot, making sure the tube is in place. I'm then going to lock it here. Now that I've replaced the tie, I've made sure that the tube is in place and the tube is locked. I'm then going to pad the tie here, protecting the patient's skin against the tie right here. So I'm gonna pad the tie, making sure the patient's skin is protected. Once I do that, I'm going to take a piece of tape and place it right over the knot here. Make sure the knot is secure. Once I have a piece of tape over the knot and I padded the knot as well, I'm going to make sure my patient is in a position of comfort. I'm going to check the tightness of the tube, making sure everything is secure. I am going to lower the bed to the lower position, making sure the patient is in a position of comfort. I'm going to remove my gloves, dispose of my gloves here, apply some hand hygiene. I'm going to document my procedure, let the physician know, and make sure my patient is comfortable, and also replace the oxygen source to my patient. Thank you.